My name is Darryl Barrett. I'm the technical lead for the disability program at WHO headquarters, and I'm here to meet with CBM colleagues to discuss our new global report on health equity for persons with disabilities, as well as talk about our support to countries to implement the recommendations of that report. So the Global Report on Health Equity for Persons with Disabilities is a report that was requested by countries, by WHO member states, looking at the highest attainable standard of health for persons with disabilities. So the report talks through the new evidence and analysis on the issues related to health equity for persons with disabilities. And it's a really important report because it's been about 10 years since WHO produced the World Report on Disability in collaboration with the World Bank. So it's been a good amount of time that's gone by where we've needed now to introduce a focus on health and health equity for persons with disabilities. So health equity is really looking at making sure that people have access to the health services they need, and it's removing any avoidable obstacles or challenges that they might face in being able to access those types of health services. The three big health inequities that we present in the report are as follows. The first is around premature mortality. So people with disability are dying up to 20 years younger than the rest of the population. The second relates to health conditions. So people with disabilities, many of them are at double the risk of developing a range of health conditions such as depression or diabetes or cardiovascular disease compared to the rest of the population. And the third major health inequity relates to increased limitations in day-to-day functioning because of certain barriers in the environment. And I think for me personally, the earlier deaths of persons with disabilities was really a shocking finding. So CBM has been a really valuable partner of WHO for many, many years, particularly around disability. And during the development of this report, we consulted very, very widely governments and civil society, including partners like CBM. And CBM was also represented on our technical experts group to give us input and feedback as to the development of the report. And it's been really, really crucial that CBM participate in the development of the report, given the experience that CBM has in a range of countries around the world. So there are a lot of things that governments need to do to drive health equity for persons with disabilities. There's really a long list, but one of the things that we would like to see and would be a game changer is if governments included representative organisations of persons with disabilities in health sector planning. So that means looking at inclusive governance. It means making sure that persons with disabilities are represented when decisions in the health sector are made, so that not only we can have smarter investments because they are more inclusive, but it means that governments don't need to have all the answers, that we can actually go to the source and actually understand what people with disabilities need in order for them to access the services they need to. So while governments around the world bear the responsibility of ensuring access to health services for persons with disabilities, they're not responsible for delivering everything that needs to happen. It's not realistic. Non-profit NGOs play a huge role in making sure that governments can do the job that they need to do in ensuring access to services. So non-profits could get behind understanding what the report is about, the key messages, and what role they play in terms of advocacy, in terms of capacity building for stakeholders, including government, and in terms of supporting the implementation through service delivery and monitoring. So many people will be familiar with the statistic of around 80% of persons with disabilities living in low and middle income countries, developing countries. So it's already a development issue in terms of addressing disability. I think what's important in this report is that it not only speaks to the health sector itself in terms of what actions governments can take, but for the first time we present some economic analysis that really says if governments take a disability inclusive approach, it means that they're making smart decisions in the health sector in terms of investment. Often the conversation around disability can be about how much things are going to cost to be disability inclusive. The analysis we present in the report really turns that narrative a little bit on its head and says, well, actually, if we take a disability inclusive approach, it is a smart investment and will actually return more benefits for us. So I think that's a really key element of the report for low and middle income countries. The report is really aligned with the rhetoric about leaving no one behind. Because we've said it, and many other development players have said that if we are to leave no one behind, then we need to make sure that we understand who it is that we've left behind and what actions we need to take. So in terms of both of those high-level meetings, one of the key recommendations of the report is making sure that we include and engage representative organisations of persons with disabilities. Taking that one step, if governments and development partners took that one step of really meaningfully engaging organisations of persons with disabilities in health sector planning, implementation, evaluation, that would make a huge difference in terms of shifting the needle in providing a pathway for persons with disabilities to access the services that they need in the health sector. Okay, great question. So in 2022, we saw for the first time health was included in the Global Disability Summit. And I think that was incredibly important given, the COVID-19 pandemic and the understanding of the importance that health plays in the lives of persons with disabilities. I think for 2025, we really have an opportunity now with this new global report on health equity for persons with disabilities to take the evidence, to take the discussion, and to take the recommendations and feed them into the Global Disability Summit so that governments and partners really have more opportunity to understand what needs to change in the health sector moving forward. I think, again, with the report, we really have an opportunity now, and we have no excuses on what needs to happen and what needs to change. We have new evidence around the inequities that persons with disabilities experience. We have new understanding of some of the contributing factors that drive these inequities, and we have recommendations for not only governments to take action, but for development partners like CBM and others to get behind and support governments in implementation of those recommendations.